Good morning. I am Vimal Ajay, final ABBT student, and today I will be presenting my research topic titled Effectiveness of Dumbbell versus Theraband exercise for anterior shoulder subluxation population. This study was done under the guidance of Pradap Sugendra Babu. Anterior shoulder subluxation is a partial dislocation of a humeral head from the glenohumeral cavity. This typically causes a trauma, ligament laxity, or rotator cuff weakness. Patient often suffer from a pain, instability, reduced range of motion, difficulty in daily activities. The glenohumeral joint is inherently unstable due to the shallow articulation and high mobility. Rehabilitation focuses on a both static structure and a ligament and a capsule. The dynamic stabilizers such as a rotator cuff and a scapular muscles. This study compares the effectiveness of dumbbell versus Theraband exercise using VAS for pain and DAS for functional improvement. Review of literature. Let me briefly summarize the finding from related studies. Several studies support the use of both Theraband and the dumbbell exercise to improve the shoulder function and reduce pain. However, this is limited direction comparison between two, especially subluxation specific population. The gap formed as basis and conduct this background of the study. Anterior shoulder subluxation significantly affect quality of the life by limiting the shoulder function. Rehabilitation often uses dumbbell to build muscle strength and Theraband to improve neuromuscular control. However, due to lack of clear comparative evidence, clinicals struggle to select the best intervention. This study aims to bridge the gap. The aim of study is to evaluate the effectiveness of dumbbell versus Theraband exercise for patients with anterior shoulder subluxation. The objectives are to analyze the dumbbell exercise in reducing pain and improving function, and effective of Theraband exercise for improving function, and compare the both method and determine the which is more effective. Methodology. This was a comparative study involving 30 subjects between 18 to 30 years, selected from the Saveetha Medical College and Hospital. Participants were assigned into two groups using closed envelope method. Group A will be a Theraband exercise and Group B will be a dumbbell exercise. They both group entered 12 weeks of training and 3 sessions per week. VAS and DAS scale were measured at baseline and post intervention. Statistical analysis was done using paired and unpaired test. Inclusion and exclusion criteria. We include individuals with anterior shoulder subluxation aged between 18 and 13 years. Both male and female were included. We exclude those with recent upper limb injuries, neurological condition, or other orthopedic issues in the shoulders. Study procedure. 30 individuals with anterior shoulder subluxation were selected based on specific inclusion and exclusion criteria. After obtaining informed consent and explaining the study protocol, participants were randomly assigned to their either groups, Dumbbell Group 15 and Theraband Group 15. Outcome measures. Here we used two outcome measures, visual analog scale to quantify pain intensity, dash disability of arm, shoulder and hand questionnaires which evaluates function through a 30-item survey. High score indicates greater disability. Here is the exercise protocol. Group A received dumbbell exercise for 45 minutes, 2 sets of 8 repetitions. Exercise included seated shoulder press, lean lateral raise, front raise, and upright row. Here is the exercise protocol of Theraband exercise. This is also for a 45 minutes, 2 sets, and 8 repetitions. Exercise includes resistance, internal and external rotations, resisted shoulder extension, shoulder abduction with resistance. Results. After a 12-week, both groups showed a statistically significant reduction in pain. Theraband showed a greater reduction with a mean VAS scores a 3.65 compared to the dumbbell group 5.27, suggesting better pain control with the Theraband exercise. With the DAS scale, similarly DAS scores both groups showed a functional improvement, but again the Theraband performance better with mean score of 41.67 compared to 50.60 in the dumbbell group. The lower scores indicate the less disability. Discussion. Our findings suggest the both intervention are effective, but Theraband exercise showed superior outcomes in both pain reduction and functional improvement. This supports existing literature suggesting the Theraband improve better neuromuscular engagement and control. Also, using the Borg CR10 scale, we are able to safely guide exercise intensity. Conclusion. To conclude, Theraband exercises are more effective than the dumbbell exercise in managing anterior shoulder subluxation. They improve muscle strength and reduce pain and enhance functional ability. This makes them the value addition to the personalized rehabilitation program. References. These are the key references that support the development and the interpretation of the study. These include research comparing exercise modalities and muscle activation patterns and functional outcome related to the shoulder rehabilitation. And thank you.